About 5 or 6 years ago, I noticed that whenever I was doing routine activities, sometimes I would have to go straight to the bathroom, or there would be a small amount of leakage of urine whenever I would do things. And I'm young, so that really did not coincide with my expected living days, or at least my activities of daily living. So for me, I really wanted to seek what was the source of that problem. So when I went to my GYN, I asked if there was anything there, because we had known after the birth of my daughter, like it was maybe 5 or 10 years later, I noticed that whenever he was doing my pelvic exam that there was a little bit of a fibroid that he was able to feel during the exam. So I was just like, do you think this might be a problem? Is this getting bigger? And he was like, I'm not sure. So he had done an ultrasound in the office and noticed that there was a fibroid, is what it looked like. So we went for a CAT scan and it confirmed that it was a fibroid and not any other abnormal tissue. So initially it was just, we'll just see how it goes. Do some pelvic exercises and enjoy your day. And that did not really resolve the situation that I was having. It was noted that it was very significant in size, and it was pressing against my bladder. And it was actually so large that it was kind of moving the bladder over, so it wasn't in the correct position of where a bladder should be. So that exactly was the reason why I was having the issues I was having. So I asked her, what was some treatment options, and the options that were provided was a laparoscopic hysterectomy or an open abdominal hysterectomy, which neither one actually worked for my life. We had plans, we had trips that we'd paid for, and that was kind of in the spring, so we'd had a plan to do some things with my daughter's school. We'd had summer vacation, we'd had fall football season and band. So there was not a time to actually have a surgery that fit into my schedule. And I also worked. So, an extended period off just did not really coincide well. And I had known that Dr. Diapoli had started her procedures here to do these uterine embolizations. And so I reached out to one of my friends who helps with radiology, and she was like, yeah, it's a good program. We've seen lots of good results. And so I asked my GYN if I could have a referral to at least evaluate if I'd be a good candidate for this procedure. I had seen that the post-op time for recovery was much less, and my feeling was if the uterine embolization did not resolve the symptoms or resolve the situation, then I could proceed with a laparoscopic hysterectomy or an abdominal hysterectomy. I appreciate the care that nursing provides here, the level of prevention of post-op issues and infection, which is really important to me. So it was very helpful to be able to have the option to come here instead of going out of state or out of our local region. I recommend to look at options, all your options, and consider what will work best for you. Not just activity-wise, but also recovery time. What will allow you to do the most in your life after the procedure.